This is Jerry Hesch at the Hesch Institute in Aurora, Colorado. And my client flew in from Philadelphia, Pennsylvania?
Yes.
About 18 months ago, he was riding a motorcycle on very bumpy terrain.
Yes.
And that caused an injury. And you can see on his pain drawing that he has anterior pain in the pelvis, lower abdomen, and he has diffuse pain throughout the pelvis, sacroiliac area, the buttocks and lumbosacral region. And you have a felt sense of feeling like something is twisted?
Yes. I felt my left side is lower.
So in sitting, you feel like your left pelvis is lower?
It feels, just moves down like that.
Okay.
I'm not sure. Yes.
Alrighty. And your pain is severe?
It's very severe.
You're rating it between an 8 and a 10?
Yes. And it's
7 to 9 is what you put.
Yeah, I'll say like from 6 to 9, but it's constant.
Yeah.
I've never sit without pain after the accident.
Yeah. So he is a philosophy student, but sitting is very painful. And twice, last year and this year, he's had to pull out of school.
Yes.
And even laying down is very painful. Do you sleep on your stomach?
No, I just really struggle to fall asleep, and every night I have to massage all these parts to get a little relief. But yeah.
And you've been hospitalized
5 times.
5 times. Was that all in China or was that here also?
I've been to several hospitals in Pennsylvania just to see specialists. But yeah, I was hospitalized 5 times in China. And because the pain was so severe, last year I went to the ER about 4 times in Philadelphia. Yeah, and I've seen so many specialists. Yeah.
Now you also have neck pain, but what we'll do is we'll do a separate film showing what I find on the upper cervical spine. But for this film, I'm going to focus on the pelvis. Leg lengths are equal. Hip motion in all directions is normal. Hip scour test is negative. Straight leg raising is full. Slump, sit, reach. Straight leg raise is normal. What I do find is areas of blocked motion in the pelvis. With him supine. The right ASIS is distinctly anterior, more so than I typically see. It is inferior by at least a half an inch using visual inspection. Now, the pubic joint has symmetry. So, my opinion is that this rotational pattern in the pelvis is happening in the hip joints. That the pelvis got stuck at an end range of rotation that makes this appear anterior and inferior. Okay, the anterior shelf is much lower on this side. Or your pelvis developed that way. So how do we find out? And the answer is we do motion stress tests. So I take up the slack on the left side, and then I spring it, and there is a backward spring and a recoil. Okay? So I take up the slack here on the left, and I spring it, and it bounces back. On the right side, it's extremely tight. I'm using a lot of force, much more than I would usually use, and there's no movement at all. I can't get that initial taking up the slack at all. There's just no movement there. Okay? I did screen for ilioinguinal, iliohypogastric, and genitofemoral neuropathy and he tests negative for that. Let's have you lie on your stomach, and then you can always take this headpiece out. So he has good mobility in multiple directions, superior on both sides, inferior on the left. But when we come to the right iliac shelf, there's no inferior mobility. Whereas on the left side, I can push down and take up the slack in the system, and I even saw his feet move. And then I can spring it, and there's that little bit of joint play. That's a normal physiological motion. And so these tests give me the conclusion of what I name anterior ilium. And again, it's not a sacroiliac explanation, although he has block motion going through the SI. The pelvis is, to our only ability to test in the clinic, it's rotated in such a way that it blocks those movements. That's all we know. Okay, we can't measure motion inside the SI joint. The other finding is that his sacrum is rather pronounced on the lower part, quite pronounced. If I were to slide my thumbs across, I wouldn't even touch my left thumb. My left thumb is on the PSIS. My right thumb is on the lower sacrum. So sacrum looks forward bent, but it's not a matter of how it looks, it's a matter of how it functions. So I'm going to test inferior glide mobility, and there's no give. There's no ability to take up movement in that direction, and that is a normal physiological movement. And now I'm trying to push on the lower sacrum to test a little bit of backward bending motion, and researchers agree that that is a movement in the sacrum. It's very small, but it is valid. I'm on the top of the sacrum, so I'm testing forward bending, and I get a little bit of slack taken up, okay? And now I spring it and it moves, and I come up to L5. Same phenomenon, we have movement there, okay? So what I call this, I name this a forward bent sacrum and a superior glided sacrum. The other evidence for that being a real possibility is the sacrotuberous ligament on both sides is very, very tight. I cannot indent it, and that's true also for the sacrospinous ligament, and that's true on both sides, just very, very hard. And you should be able to indent that ligament slightly and give it a little bit of spring. The other thing that I find is that his coccyx appears to be side bent left. So there's a deeper sulcus on the left side, and if I come to the left side of the coccyx, and I stack my thumbs and I try and spring it to the right, there's no movement. I'm going to do the same test and see if there's joint play going to the left. So now I'm on the right side of his coccyx, and I stack my thumbs and I give a little bit of spring, and there's movement. Can you feel that?
Yeah.
Okay, there's a little tiny bit of spring. Okay. So these are my findings in the lower body. I will later do a detailed muscle evaluation, soft tissue excursion, skin excursion evaluation. You know, certainly could involve sensory nerves as well. But these are the gross movement findings. And there is the possibility that with the vertical forces, remember he was on a motorcycle on a very bumpy area, which, interestingly, that's how I had my motorcycle wreck at age 17. And for me, that was life-changing. But it could be that this ilium not only, or the pelvis not only rotated, as we described, but it may have also jammed vertically on the right side. That's another possibility. So I'm going to stop filming here, And my treatment will be directed at restoring motion in all the directions in which it was absent. And then I'll do a film on how I accomplish that. And we'll also show how mobility increases if we're successful. So, thank you.